Good morning.
Good morning.
How are you?
I'm doing fine.
My name's Adam Freedhand. I'm one of the joint replacement team members here at Physicians in the Department of Orthopedics. I come from a sports background. I used to race kayaks when I was younger, but I participated in all kinds of sports as a kid. I grew up at the beach, and so I thought I would go into sports. Then I realized as I went through my orthopedic residency training that I didn't gravitate towards those patients as much as I gravitated towards taking care of older patients. And I really thought, for me, it was more rewarding to help restore mobility and alleviate pain through joint replacement. I had a lot of wonderful role models as a kid. Although my dad is a lawyer, he was all about everything science and supported me when I was a kid and my interest in pursuing, scientific studies and things like that. I really was kind of deeply engaged in that as a youngster and really wanted to be a doctor. And so that's kind of what I pursued, and I kind of stuck to it.
We can see how well you're doing, how much you're using it.
Joint replacement surgeons over time have tried to minimize the surgical trauma, meaning the incisions are not as big as they used to be. We don't cut as much muscle as we used to cut. We've introduced new surgical techniques such as direct anterior hip replacement surgery to try and benefit the patient, having them recover faster, have less pain. So it doesn't require much motivation for me to get out of bed in the morning and come to work because of things like that, right? I mean, patients by and large do great, and they're incredibly grateful. I saw a patient this morning as an example who basically said, all my pain is gone and that I've restored 100% of his mobility. And it's things like that that just, this is why we do it.